Hello everyone! Welcome back to MJ Pharma. Today's focus, the drug of choice for common eye disorders, from conjunctivitis to glaucoma, will cover the go-to treatments you should know. Let's get started! Drug of choice for open-angle glaucoma. Prostaglandins analogs. Drug of choice for closed-angle glaucoma. Acetazolamide. Drug of choice for secondary glaucoma. Beta blocker like metoprolol. Drug of choice for inclusion conjunctivitis. Ceftriaxone. Drug of choice for trachoma. Azithromycin. Drug of choice for primary open-angle glaucoma, POG. Timolol. Drug of choice for xerostomia. Cevimeline. Drug of choice for corneal ulcer. Cyclopentolate. Drug of choice for hypertension with glaucoma. Timolol. Drug of choice for iridocyclitis. Atropine. Which beta blocker is the drug of choice in open-angle glaucoma? Timolol. Drug of choice for hepatic keratitis. Idoxuridine. Drug of choice for fungal corneal ulcer. Natamycin. Drug of choice for uveal herpetic keratitis. Acyclovir. Drug of choice for preventing meiosis during cataract surgery. Fluorbiprofen. Drug of choice for mild allergic conjunctivitis. Topical antihistaminics. Drug of choice for decreasing intraocular pressure before surgery. Osmotic diuretics like mannitol. Drug of choice for decreasing high intraocular pressure. Osmotic diuretics. Drug of choice for recurrent anterior uveitis. NSAIDs like indomethacin. Drug of choice for reducing intraocular pressure in diabetes. Osmotic diuretics. This is for educational purposes only. Always follow medical advice before using or recommending any medication. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.